Kenya has, for the very first time in nearly a decade, recorded an increase in the number of new HIV infections, with 34,540 people tested positive for HIV in 2021. The figures putting a spanner in the works for the country's HIV response programs, which have been marked by declining donor funding of up to 10 billion shillings and shrinking domestic financing. And as Laura Otieno reports, there was a drastic increase in the number of HIV-related deaths in the same period, even as low-burden counties recorded up to 30% new infection rates.
Country gearing up to celebrate World AIDS Day on Thursday, Kenya has flashed the amber light on its HIV intervention measures after 34,540 new infections were recorded in 2021. The new infections signifying a 7.3% increase after nearly a decade of declining new infections curve, putting the National Endemic Disease Control Council on a pedestal to clip the numbers from rising further. Women bearing the brunt of the new infections at 66.7% of the new infections, compared to men who accounted for 33.3% of the total number. 17,961 adolescents and young adults aged between 15 and 29 years tested positive for HIV in 2021, with this age group bearing the burden of new infections at 52%. This coming amidst declining donor funding, which had shrunk to 7.3 billion shillings by 2018, followed by the withdrawal of US-funded PEPFAR in 2019, as donors pushed for countries to support their health programs by internal funding. As of this financial year, 2022-2023, Kenya's annual funding gap for essential HIV commodities stands at 100,454,190 shillings, including a 6-month buffer commodity stock, even as counties report a biting shortage of condoms, ARV drugs and testing kits for HIV.
Tunakuwa na targeted testing kwa sababu ya uhaba. Saa hizi ningependa kusema kwamba wafadhili wetu inafika wakati ambapo sasa tunaambiwa fanya mikakati zenu. We are supposed to be independent.
Labda unaweza pata mama ambaye ako na HIV na saa inafika hauna vifaa, na labda inabidi utafute kama karatasi shuka bag uweze kumsaidia.
In the past year, Nairobi County led the bulk of infections at 3,828 infections, followed by Kisumu at 3,118, Homa Bay at 2,696, and Siaya at 2,180. A total of 22,373 HIV-related deaths were reported in 2021, a steep increase in the number of deaths, which was attributed to low diagnosis and low treatment coverage across various populations. Focus will now shift on the various programs that will be adopted by government to nip in the bud the rising numbers of new infections and deaths, and how it will be bridging the near 10 billion shillings funding gap as more donors plan to pull out funding for key programs by 2027. Laura Otieno, Citizen TV.